Hello?
Thank you very much, Dr. Francis Smart. That was just an amazing presentation, very insightful, filled with so much actionable insight, knowledge. We're grateful that that you supported us this way, and I think that you spoke a lot for Sierra Leone, but also you spoke a lot for the continent of Africa. Many of the scenarios that you put forward are relevant across the continent, and especially in sub-Saharan Africa. So I'm sure that many of us in the audience listening, and many that will listen after today, because the presentation will be in the public domain, will benefit from the information that you have put out. There are a few questions that have come through, but I will not ask them at this moment. I'll proceed to the next speaker, and after that, I hope that we can ask the questions. Just before we move on to the next speaker, though, I'd like to say a few things about some of the things that we're doing at the World Trade Center Accra. I already talked about our One Africa initiative, which is going to take delegations from Ghana to several other African countries in order to encourage B2B engagements across the continent. And we are being supported to do this by several embassies and Ministry of Foreign Affairs across the continent. We also have the International Trade Accelerator Program, which is seeking to help local businesses export their products and services through the World Trade Center Association network around the world. So we're exploring new market opportunities for local African businesses. But the International Trade Accelerator Program is also serving foreign companies outside of Africa who do not have local representative offices in Africa to assess the market here. So if you join the program, you're getting daily reports, presenting your actionable market insights, and so on and so forth. These are some of the things that we're doing here at the World Trade Center Accra. Last year in May, we held the International Financial Crime, Money Laundering, and Cyber Fraud Summit, which was well attended across the continent. We had speakers from all over the world and also on the continent of Africa. I think that event was moderated by a senior vice president of Moody's, a former senior vice president of Moody's. And at that event, we discussed how international financial crimes, money laundering, and cyber fraud was affecting trade in Africa and preventing African businesses from entering global trade and African financial system from integrating into the global financial system. And we were able to draw a direct link between international financial crimes and the increasing rates of poverty on the continent of Africa. We also held the Africa Circular Economy Summit, where we had, I think, 16 speakers from outside and within the continent, and there was representation from across the continent where we demonstrated why circularity was a more sustainable concept in industrialization than linearity, and also not only in industrialization for the development of the continent. We had the Africa Digital Economy Summit last year, which was also focused on looking at the digital economy and how it could spur the economic development of the continent. The World Trade Center Accra does some of these things to throw the spotlight on some of the big sectors on the continent and how we could develop them to spur on the development of the continent. In a few weeks, we are going to hold Africa Feeding the World Summit, which is going to be a summit to discuss how we can turn around agricultural productivity of the continent of Africa so that we do not become just a recipient of food aid, but we could become a net contributor of food to global food security. Because of course, we have 60% of the world's arable land, and we have a lot of young people that need to find work. So we're going to hold the Africa Feeding the World Summit. It will be followed by the Make in Africa Summit, where we are going to look at manufacturing and how we could promote the manufacturing sector and direct investment into the manufacturing sector, into the industrialization agenda of Africa. We're going to promote Africa as the next manufacturing hub of the world in this summit. So these are some of the things that we have coming up. I would like now to invite Mr. David Sam Esando, who's product manager at NGCS, is going to give us a presentation that will focus on medical devices and consumables as it pertains to the healthcare sector in Africa. David, if you are with us, I'd like to hand over to you now. Take it over from here. Thank you.
All right. So good afternoon once again. My name is David Samisandro. I'm the Business Development Manager and Product Manager for Diagnostic, Imaging, and Surgical Workplaces for NGSS, a biomedical firm in Ghana. I'm doing this presentation on behalf of my CEO, who is a bit under the weather. Basically, we're talking about the medical device industry as it pertains to Ghana and all other health sectors around the world. The medical device is any device that is intended to be used for medical purposes, mainly to benefit the patient and also to provide diagnosis and treat patients to overcome their diseases or illnesses and improve their overall quality of life. The medical industry has a $447 billion market size, and it's expected to rise to about 670 in 2027. And then beyond 2027, it's expected to go around 800. And this is a report from KPMG. And now narrowing down to what NGSS does primarily in our sector, medical devices and its consumables are the lifeline of any healthcare system you would find in the world, cut across, whether they are low middle income status countries or highly first world countries. The medical device sector is what runs the hospitals or the healthcare industry aside the human resource of the doctors, patients, and other allied health human resource. In 2030, we are envisaging in Ghana the universal healthcare coverage. And in line with that, our company, NGSS, has also taken it upon ourselves to approach most of our products and services, which are in different areas, to be able to provide a sort of holistic and value-based provision for Ghanaians, and not only Ghanaians, but also leveraging on our unique set of skills and expertise to contribute to the overall healthcare focus in Ghana, in Africa, and other lower middle income countries. And just as it's a company that has over 200 years worth of experience between our partners worldwide, we expect to help Ghana and the African West sub-region to implement health projects in planning, consulting, sales, training, installation, and maintenance of cutting-edge technologies and solutions that are necessary to enhance and improve the delivery of healthcare institutions. We have aligned with several world forefront runners in the innovation of healthcare products, such as GE Healthcare, McKay, Escala B. Brown, Diettinger, and Matec and Nora, all situated in different continents around the world. And because we strive for the gold standard, we as a company try to, as much as possible, enter into PPP agreements with most of the facilities we deal with to be able to offset or defray the costs involved in acquiring high capital intensive medical equipment such as MRIs, CTs, and X-ray equipment, which are over $100,000 and upwards. That aside, we have minimum consumables that we also deal with. Looking at the rise of disease burden in Ghana and then cut across Africa, we are seeing most imports being close to the neglected tropical diseases, and then the increased rise in NCDs. So we are bringing in more chronic patient machines for dialysis. We are seeing more requests for stents for the heart valve for CABG procedures, that's aortic valve replacements, and then for most cardiothoracic complications, we are seeing more and more of them. So this is where the disease burden is shifting now, and we are also poised to be able to fit the position we have been given it as a medical device and biomedical engineering company, to be able to train the doctors sufficiently to be able to use these equipment to correspond to the rising incidence of disease that is coming up. With the COVID impact, it has sparked a broader appreciation for our healthcare systems overall. Now there's now a wider understanding of the epidemiology and technology behind the collection and disease testing. And then we are seeing that the medtech companies like us and then big pharma were companies that are here to stay. Unlike the big pharma, which are seeing stock rises in the market, most of the medical device industry, both the OEMs and distributors like us, we're seeing a short-term hit, but we are expecting to bounce back faster than the travel or hospitality industry. Although it's been a bit volatile based off the new trends that is going on, we hope to catch up very soon. As at July 2020, we saw an injection of $9.1 billion into the digital health funding. This is for both startups and big players in the healthcare industry, which we have been fortunate to be beneficiaries of. We recently had some funding from the KFW to set up a dialysis center to help chronic patients. That was initially before the COVID, and then as the COVID came around, we are now branching into more oxygen generation, medical oxygen generation opportunities, which we have had a lot of requests for. With the challenges we face, we have been facing quite a huge hurdle, because Africa, or Ghana, if I should use our case context, has been one rife with a lot of financial constraints based off our ineffective, or should I say, otherwise maimed health insurance policies that have a lot of backlog of payments for these state-run healthcare facilities. As such, the healthcare facilities in turn do not have the capital to restock on these medical device and consumables for the efficient running of the facilities. Therein, we step in with our PPP innovation to try and alleviate this burden off, and then also in step be able to reach our goal of UHC 2030, where we have everyone having access to good quality healthcare based on value. Yes, our story is quite simple. We are a company that began in 2008 with starting active business in 2009. We have two major divisions in NGSS. We have the technical division and the products division, where we handle the installation of medical equipment. We also do turnkey projects, fully served project, and we have been fortunate to be part of some historic projects around Ghana. We're part of, in 2016, Ridge Medical Hospitals, where we installed over 80% of the medical equipment over there, the installation and training of the medical personnel over there. We were also involved in the URACare diagnostic center in cantonment. We built the theaters, the infection control systems, and the surgical workplaces for the whole of International Maritime Hospital. And then we also did a full turnkey project with the Providence Specialist Hospital, which is Professor Frimpong Boateng's cardiothoracic unit. Yeah, so we have categories where we deal with our critical care. There's with the operating rooms, your recovery wards, your intensive care, your cardiology and cardiothoracic unit. Our infection control deals with high pressure steam sterilizers and automatic washer disinfectors. So we intend, should I say, help hospitals run without a fuss. We make sure that our professional team of engineers and their affiliated companies that are part of us make all healthcare institutions run efficiently without a fuss. And this is one of our core mandates. These are additional areas that we also deal in your radiotherapy, your clinical laboratory, renal dialysis, your dental systems, ophthalmology, and ENT. We deal with your physiotherapy, and then, as I mentioned, full turnkey solutions. With the 88 hospitals that has come up recently in 2020, as the president mentioned, we are highly involved in most of them from the ground, and we hope to have them up and running as soon as most of them are the swords are cut for most of them. Yes, we are estimating around turnaround for 18 months to have most of them finished. Yeah, so our management team has consisted of our CEO, our director and founder, Mr. Pierre. We have consultants from US, Germany, who are part of our executive board and our technical staff, also in academia. And the rest of the team in administration and product sales and electrical and technical systems. A cross-section of our partners, world name brands, which I say we share over 200 years worth of experience between them, and major players in the medical field. In Germany, we have the B. Braun and Weiss Tech, the Enmantech for the oxygen generation, the Nora for your cardio supplies, your Fazini for your basic hospital retrofits, Terimo also for the cardiology suite, StenMed and Gettinger for your imaging and a diagnostic suite. These are a cross-section of our clientele we have dealt with over the years. The Embassy of the United States of Japan, the Global Foundation for HPGH, KPMG, AMPC, Netherlands, who are part of our core turnkey partners, the National Cardiothoracic Center, Kolebu Teaching Hospital itself, the Eurocare, CNJ, Focus Orthopedic, Ridge Medical Center, and then Ridge Hospital, also the regional hospital. We deal with the Volta Regional Hospital, Covenant Family, Global Dialysis, as I mentioned, and we do some pro bono charity work through the Latter-day Saints and then other institutions. The plates you see before you are some of our recent work we did, where we came with a memorandum of understanding between Kolebu and us to finance and transfer the medical oxygen plant we are installing now. With the incidence of COVID, we have seen that Kolebu was spending almost 200,000 Ghana cedis a month procuring oxygen, and this was industrial oxygen, which was below 70% oxygen purity, not meant for medical use. So we are there to set it up and then build, run, and then transfer with our PPP model. And this project is over €1 million. Yes. In 2019, the chronic dialysis patients set up the Global Dialysis Center in Tesano. Started with a 3-chair renal dialysis setup, and then we have increased to over 10. And this is the minor oxygen plant and bottling unit for the cardiothoracic center. So this feeds only the cardiothoracic center, secluded from the main Korle Bu Teaching Hospital. And this was from work at Ridge Hospital during the construction and installation phase. Yeah. We actively engage in applications training where we send doctors and nurses for refresher courses outside. And we also have experts fly in to train the doctors on the machinery we supply and install. And we also have a strong maintenance team to make sure that the hospitals have value for the money based on the life expectancy of the equipment they purchase from us. Yes. So we make well and sure they are maintained beyond their life expectancy. So thank you. Any questions? This is the end of my presentation.
Next up, Madam Lucia Adai Interior will give us a presentation on investment opportunities in the pharmaceutical manufacturing industry in Africa. I would like to jump straight into it and hope that we can have Honorable Senator Mutahi Kagwe speak after that. Madam Lucia, kindly take over from me. Thank you.
I'm speaking on investment opportunities in the pharmaceutical manufacturing industry in Africa. I'm hoping that Esther can help me share my slides. And I would say that I'm not going to go into details. I'm just going to do more of a teaser so that most people can have an idea of what the investment opportunities are. I think Mrs. Theresa Hampson has done a fantastic job in her presentation of ensuring that she highlights a lot of our challenges, what we are doing. So I would not go into the nitty-gritties. So the outline mainly is or a little bit on PMAC that I'm representing, and then WAPMA, and then we'll talk about FAPMA. I'll go into details of what the acronyms are. I'll speak a little about the investment opportunities, and then we'll talk about after. I think it's important that I state that Henry Ford once said that our coming together is actually the beginning, and if we're able to work together, then we make progress. If we can actually stay together and ensure that we improve on what we are doing, then that's fantastic and that's success. And then I believe that in order for us to work together, we should be able to engage, and this is the beginning of it. I'm hoping that we'll have more of these, bring on board more of our stakeholders from the manufacturing sector, so that we can tell you a bit of our problems, our challenges, and then probably that can also come into the opportunities, the strengths that are available, and of course we can tailor that to see what we can do for Africa. One of the questions I saw was what we are doing in Africa to actually improve the system, especially with COVID being around. I can assure you that there's a lot happening in the background. It's very, very slow, I agree, but it's important to get the framework right. Once we can get the policy framework right, then it becomes easy for us to do a lot of things. And it's also a lot of engagement and a lot of things to be done, because you can have a policy sitting somewhere that is done properly, but it's important to have every stakeholder in the chain actually understand what it means to actually move commodities from one country to another, from one place to another, and actually what even goes into it. I mean, getting the raw material, where does it come from, actually formulating it, right to manufacturing the tablets and then to the patient. It's a lot of systems and structures, a lot of hard work. And I believe that all these engagements would actually bring the right stakeholders to talk to each other and see what we can do for one another. So for the pharma industry, just a little bit about it. So apart from representing the Pharmaceutical Manufacturers Association of Ghana, which is PMAG, I also represent the West Africa Pharmaceutical Manufacturers Association, which is WAPMA. And I also sit with Pharma, which is at the continental level. So I sometimes attend some of the board meetings and I know what is happening at the continental level. There's a lot being done in terms of engagements. The secretariat needs strengthening. And of course, we need a lot of support from the various governments because the countries are autonomous. So you can form a policy, but you need the countries to buy in and agree to do some of the things that you have outlined. So there's a lot of engagement in the background as to what should be done. And sometimes there is help from one person to another, information being transferred, technology, but we need to do more and maybe a bit quickly, maybe hasten a bit cautiously so that we can get to the objective that we set out for ourselves. So the pharma industry in Africa, the various organizations I have mentioned actually have the large and medium scale pharmaceutical manufacturing companies. So they would employ anything from 100 to 500 and over employees directly, and then have people that they employ indirectly. There are the small scale pharmaceutical manufacturers, and they are coming in gradually. For instance, I can use the case of Ghana, where we have the large and medium scale being about up to 40 members. We have up to 20 wholesalers and then importers who are also putting their house in order so that they can join the manufacturers. And then we have the small scale. The small scale has grown from about 40 members to about 150 members. So you see that even though they are not captured and they are not being highlighted, we have a lot of the small scale manufacturers who are still doing some of these preparations to be able to fill in the gap. And they are also very key and important. Even though their staff strength and their production capacity might be very low, it's important we support them at that level so that they can grow. And once they grow, then you will see that the medium and large scale would actually be able to grow. And one day we can become like the India and all of that, who is actually trying to be the pharmacy of the world, so that Africa in itself will be self-reliant when it comes to health and medicines generally. And this is important because we need to be able to protect our medicine security. And every country should take that very seriously. If we don't, then we are in trouble, because when you don't have medicines, then what happens is that some of the top health disease burdens will actually be able to wipe away some of your workforce. And even if it doesn't wipe it off, what it means is that some of your workforce will not be able to work effectively. So it's important to ensure that your medicine security is actually protected all the time. Generally, most of the things that we manufacture in the country in the continent are the tablets, the capsules, the syrups, the suspensions, infusions. In Ghana, for instance, we have 2 infusions companies. We are having 2 more, and they do the large infusions, what we call the drips. What we are pushing towards is the small parenteral. So you have things like the vaccines, things like the injectables. Those are the kind of things that we don't have a lot of in the continent. In West Africa, for instance, we've been able to have 2 companies set up in Nigeria who are doing vaccines, and then we have one in in Senegal, sorry. Ghana has one coming up, which is transatlantic from Anova. And then we are trying to get all the government support, all the marketing framework and everything that they need to be able to survive. Because a lot of these companies will rely heavily on government. Government has its burden and lots of other things it's supposed to focus on. And so the push is that they should receive some finance, which is affordable, and also be able to get markets from government and ensure that they are paid on time and then within a realistic price or policy framework. So like I mentioned already, the medicine security is crucial, and it also helps the development. I'll speak a little to the macroeconomic indicators. So PMAG is Pharmaceutical Manufacturers Association of Ghana. It's been in existence for 30 years this year. So you realize that we've been around for a little while, and there's a lot of work, there's a lot of things we've pushed for, some of which are exemption on taxes, duty, VAT, when it comes to the active pharmaceutical ingredients that we manufacture with, and also the packaging material. Another thing that we've been able to do, which is significant, is also be able to get the restricted medicines list, which Mrs. Hampson spoke about. What it means is that there are some products that are restricted only for local manufacturers. So the multinational companies who actually manufacture some of these molecules would have to rely on local manufacturers. And that has helped us grow our capacity. It's helped us grow or be able to get some technology transfer. It's helped us grow the industry generally to be able to employ more people and do more. And gradually, we are seeing that some of the manufacturers who some years ago could only do 2 or 3 products are now able to do 20 or 40 products. So we are seeing a growth, you know, in the number of people that are manufacturing, the companies that are manufacturing, their capacity, and a few other things that they do. We have 37 members, like I mentioned. There are a few members that have gone down but would come up. We used to have an active pharmaceutical ingredient company, which is the gray, but it's gone down because of management and financial constraints. And we are speaking to the government to see how we can bring La Gray back, because La Gray was one of the companies that was doing azithromycin, which we all know is key in the management of COVID as at now. And would have been fantastic if we're having this molecule available and affordable for all the 37 members. We'll also have 20 members who are doing importation and manufacturing join us. So the numbers will be increasing, you know, gradually. So you see that once the large and medium scale manufacturers are actually increasing, the small scale are also feeding or also growing to actually be able to fill in. So it will be huge if Ghana can move from the 37 members that we have to something in excess of 200. And the 200 is actually the large and medium scale manufacturers we have in the whole West Africa. So if Ghana alone can move to 200, then you can imagine what the other sub-Saharan African countries can do within the time frame if they have the necessary support. The population of Ghana now, according to Odometer, is about 30.42 million. It's estimated by McKinsey and a few other stakeholders that we do about 600 million with a compound annual growth rate of about 11%. What is happening actually is that the local manufacturers do 30% of the value of this figure, which is the 600 million, which means that the investment opportunity is that if you want to invest, you can invest in some of the other molecules that are not being done in the country. You can invest in the packaging materials and any other support services that are not being done in the country, which fills the 70%, and that would help the local manufacturing industry to grow if you want to invest in the sector. So we're welcoming investors, anybody with ideas, opportunity, resources to come on board to help us to grow. Ghana is very respected in West Africa and forms part of WAPMA, which is West African Pharmaceutical Manufacturers Association. WAPMA has been in existence for 16 years. Even though there were several other manufacturers, we had to do a lot of coming together, engaging, working together to be able to achieve the West Africa Secretariat. There are 200 members. All of these are companies that form part of WAPMA, and they are very active and vibrant. A lot of them are the large and medium scale. Like I mentioned, there are some small scale pharmaceutical manufacturing companies that are being supported gradually to grow to that capacity so that they can become part of PMA, WAPMA, and then FAPMA. The population also, according to Odometer, is 367 million people in West Africa, which means that when you manufacture in Ghana and then you are working through the ECOWAS framework, you have access to not just your 30 million, but to 367 million people who potentially would have a reason to use one of your solutions, be it medicines or commodities. It is estimated that the drug market or the pharma market is about 5.8 billion in West Africa, and also has CAGR, which is a compound annual growth rate of about 6%. Predominantly, we do a lot of importation. So you will have up to 70% of this value being imported medicines, 30% of which is locally manufactured. So there's again the investment opportunities to actually do more in bioequivalence, in support services, in active pharmaceutical ingredients, in vaccines, be it COVID or even what we use for children in polio, in all the other disease areas, so that we can grow what we are doing locally and then reduce our import or reliance on the world generally. Then there's FAPMA, the Federation of African Pharmaceutical Manufacturers Association, established 8 years ago in Ethiopia. Again, it took a lot of engagement. There are 54 countries, and then these countries are in 3 regions mainly. So we have the North African countries that we are engaging to become part of FAPMA. But generally now, we have West Africa being part of FAPMA. We have South Africa being part of FAPMA. And South Africa, I mean all the Southern African countries. And then we have East Africa being again part of FAPMA. The population of Africa is somewhere between 1.2 billion. I'm seeing that there's a growth to about 1.3 billion, 1.34 billion people in Africa. So you realize that with AFTA, what it means is that you produce in Ghana and you have access not just to your 30 million people, not just to your 367 million people in West Africa, but actually to the somewhat 1.2, 1.3 billion people in the whole of Africa who would be able to need some of your medicines. So there are some of the African countries that are struggling with manufacturing that we are trying to see what we can do in terms of being able to formulate some of these medicines, forming some MOUs with governments, being able to transfer some of these medicines there, even setting up locally there so that the people can have that medicine security of knowing that when my head aches, I know that there's paracetamol available in my country. And there will not be any shortages, because what happens and what we saw with COVID is that when there are shortages of some of these medicines or commodities, you will quickly have prices going up. And at the macroeconomic level, it affects everything. Also at the microeconomic, what happens is that some households will not be able to afford it, and it reduces access. And when you take a disease like COVID, what happens is if one household is not able to protect itself, then there's that possibility that they can infect other households, and then the disease burden is still there. It still causes the morbidity and mortality. You still have people dying, and that's a big challenge for a lot of the governments. So the pharma market size is estimated by Goldstein Research to hit about 160.7 billion by 2024. So you see that with COVID, we are seeing an increase in local manufacturing. And even though there's been some disruptions in supply chain, we're seeing a growth. I saw a report by McKinsey that stated that between 2003 to 2013, there was a huge and astronomical growth in the pharma market size. It moved from somewhere 4 billion to about 20.8 billion, which is significant. And today you can see that in the next 3 years, we're hoping to hit 1 billion. So the investment opportunities are available. A lot of this is actually imported medicines, but it's important that because Africa has to be positioned, or because Africa is generally becoming self-reliant or pushing for that, it's important that investors look at investing on the continent for the people of Africa to take care of African people. So the investment opportunities, like I mentioned earlier, are that you have opportunities to be able to invest in vaccines. We have some of the companies being able to position themselves so that even if they cannot manufacture the vaccine itself, they can do the filling in the country by some arrangements or some partnership with some of these multinational companies. And gradually what will happen is that you will have some of these companies be able to do their own vaccines. It takes a lot of money and effort. In Ghana, we've got some support from government to be able to set up some of these manufacturing companies. And you realize that to be able to hit a company that has good manufacturing practices, world standard, has your WHO pre-qualification, you're looking at something between $10 million to $15 million, which is a lot of money. Money in Africa is difficult to come by. And generally, this money is not even affordable. because in Ghana, you will have companies borrowing between 10 to 30%, depending on your market size and a few other factors. So imagine if you are borrowing money for a long term, for a structure and for systems, and you are borrowing at 30%, that is huge, and that in itself can actually collapse your business. So there has to be a lot of engagement so that the various banks and various investors will see healthcare as being very important, essential, and being able to make some considerations to reduce the interest rates, and then create some modalities where you have the moratoriums, you have a long-term negotiation, you have some tailored solutions for pharmaceutical manufacturers so that they can grow and be able to take care of people in the region. So there's also anti-snake. It's also another area that people are looking at. Generally, apart from that, there are other, let's say, medications like the injectables. We have several other injectables, several other medicines that are not manufactured in the continent. And then there's that investment opportunity to be able to invest and do that. And once there's that engagement with the various governments, then you are sure that the business will come directly to the company that has built that capacity to be able to do that. We generally import a lot of pessaries, a lot of suppositories, which there is market for to be actually made in the country or in the continent and actually procured by several other governments. Then there's the discussion around active pharmaceutical ingredients, so that they will be made here in Africa and not imported from Asia, because you realize that now with freight charges going up and with challenges in transporting, especially because of COVID, it is important to have your API made in your continent so that you can have it just in time and it can be affordable and accessible for the various companies to manufacture the medicines that are needed. There's also excipients. So apart from your active pharmaceutical ingredient, there are other ingredients that are added to it to actually formulate it, either as a syrup, a tablet, a capsule. And a lot of these excipients are also imported. So there's that investment opportunity. The packaging materials are also available. So a lot of our packaging material is actually imported, which is not a good story for Africa. So there's that investment opportunity. So some of the 70% of the values that I mentioned actually goes into some of these things, the vaccines, the API, the excipients, the packaging materials. We still do our bioequivalence largely from India, sometimes in South Africa, but it's important to have the bioequivalence services available in every country so that we can do comparative studies. And once this is established, then what will happen is that that need or that affinity to have imported medicines will be reduced. Because if you have the science backing locally manufactured medicines, then you don't necessarily have to go for imported medicines. You can actually take a locally manufactured medicine, knowing that the efficacy, the safety, the toxicity and everything is comparative to that of an imported medicine. Then there's the support services. Sometimes you have to bring personal human resource from outside the country to come and take care of the pharmaceutical industry. And all of this is not the best. So it's important that we can be able to establish companies or industries that will support the pharma industry. And all of these are available. Some of these factors that are contributing to the growth in the numbers that we are seeing is because economically, some countries are being able to move from lower to middle income. We see the improvement in the macroeconomic indicators. We see an improvement in the number of people that the companies are employing. We see an improvement in the depreciation of the currencies. We see an improvement in inflation and other factors. There's also rapid urbanization. Of course, with that will come first aid kits and being able to take care of your family by accessing some of these medicines. We also see a growth in the government's national health insurance schemes, or the kind of policies that are available to cover universally the households. We also see, apart from the government side, the private sector putting up some of these healthcare policies to be able to take care of families. But of course, you should be able to afford it, and it comes at premium fees. So there's increased healthcare spending and investments. I saw from the previous presenter that government has had some engagement and is building 88 new hospitals in Ghana. And what is happening is, apart from these 88, there are some 30 other hospitals that are actually being refurbished or being upgraded. And so that forms the Agenda 111, where you have new hospitals. Generally, from some of the reports I have read, on the continent, we are seeing a growth in the number of hospitals, some good numbers in the thousands and in the 10,000s across the continent. We are seeing an increase in the number of doctors, healthcare practitioners, pharmacists, nurses, and all of these are key, because if you want to be able to increase healthcare, increase access, make sure that universally every household is covered, then some of these factors would have to be considered. Then there is increased incidence of chronic diseases like hypertension, diabetes, and the rest. And all of these are causing the growth in some of the figures that we are seeing, the values that we are seeing for the pharma sector. Then there is AFTA. So AFTA is Africa Continental Free Trade Area or Agreement. Strategically is to help us deliver our goals of for Africa, and healthcare is included in there. There are some policies that would come up to reduce the tariffs, to be able to create that infrastructure, be it road or railway, and all of those other transportation or logistical factors that would be needed to be able to move pills from the manufacturing, or even before it is manufactured, the active pharmaceutical ingredients, to its formulation and then to the patients. And then there are regulatory issues. You should be able to register your medicines. You should be able to go through all the compliance issues, and then your medicine will be certified so that the patient can be able to access all the medicines. I've already spoken about the macroeconomic, the microeconomic indicators, so I'll skip that. But I would say that generally there are lots of reports showing that there's an improvement at the macroeconomic level and at the microeconomic level. So in concluding, I would say very simply, AFTA is giving us a huge opportunity in Africa to be able to grow the various companies and the various industries. It's estimated that some 30 million people would be lifted from extreme poverty to either a lower middle income status or a middle income status, out of abject poverty, and that is huge for us. What it will mean is that there will be injection into the various companies or the various industries. There will be growth. I must say that even though some industries are struggling, the pharma industry is consistently, significantly increasing its impact on the continent. And that is why a lot of governments are actually investing more and more money and resources to the healthcare. It's creating a platform so that we can move, let's say if you're at Ghana, from your 30 million people to have access to 1.3 billion people who would actually be able to take your solutions or your medicines, and that would ensure that you can grow. Of course, you need money to be able to grow, and that's why the various secretariats are there to be able to engage the relevant stakeholders and ensure that whatever finance options are available, we actually make members access it and grow accordingly. COVID-19 has disrupted the supply chain. We've seen that prices of commodities have increased, access has become a challenge here and there. But all of that with AFTA is actually poised to make sure that the industry can grow significantly. So I'll conclude. Thank everybody. I'm available for questions. If you want to speak to me later, we can have engagement. I'm sure that there are some stakeholders who are listening that we can collaborate with, who would help the various organizations, various industries to be able to grow, so that in future we can look back and be happy about what we have done over the years. Thank you so much for the opportunity. And then I hope that you would ask me a lot of questions and engage me later. Thank you. So over to you, Mr. Chair.
Thank you, Lucia. Great presentation. I am reliably informed that Honorable Senator Mutahi Kagwe will not be with us, but the Director of Health, the Director General of Health of the Ministry of Health of Kenya, Dr. Patrick Amoth, will read a speech on his behalf. We are highly honored to have you join us. Thank you very much, and please take it over from here. We cannot hear you. Yes, now we can hear you, I think.
Okay, thank you. Dr. Francis Smart, Director, Policy and Information, Ministry of Health, Sanitation, Sierra Leone, Directors, CEOs of health institutions, Presidents, Executives of health associations, World Trade Centers around the globe, healthcare practitioners, ladies and gentlemen, good afternoon, good evening. The Africa Health Industry Summit is a welcome and timely initiative, and I'm glad to join you as we deliberate on the health situation in our region. This is indeed a good time to measure the pulse of the continent's health sector in view of the current challenges of battling dual epidemics of infectious and non-communicable diseases in most of our countries. Kenya, like other African countries, is experiencing increased cases of non-communicable diseases such as hypertension, diabetes, and cancer, alongside infectious diseases such as HIV, TB, and malaria. The health sector plays a pivotal role in Africa in ensuring our people are healthy to actively participate in socio-economic development. The threat posed by the COVID-19 pandemic has so far led to devastating socio-economic effects, both globally and at the local level, and has slowed down all the strategies and plans for economic growth. The current COVID-19 pandemic has made us realize that we cannot do it alone as a country, and that we will require regional and global cooperation both bilaterally and multilaterally. As the African Union, the continental response to COVID-19 and Africa's CDC have supported our COVID-19 response through invaluable guidance, coordination, and resource mobilization efforts that they have spearheaded. In the East African community, we have worked with other member states to coordinate efforts to enhance COVID-19 response, particularly at the border points. We are also working tirelessly with our neighbors to handle cross-border movement of trucks so as to facilitate trade and flow of cargo across the borders amidst the pandemic. Ladies and gentlemen, partnership is clearly the way to go in assessing and capacity building our health sector to progressively deliver the highest standard of healthcare. It will require strengthening existing collaborations and forging new alliances with potential partners in healthcare in both the public, non-profit, and private sector. Some potential areas of collaboration we are seeking are infrastructural development, addressing the human resources in health needs and health product gaps, while leveraging on the use of technology to increase access to health services. Additionally, there is need to strategically plan for sustainability and self-reliance across board. To this end, Kenya has taken huge strides towards achieving universal health coverage, which is a priority agenda of the government of Kenya. This will be realized through the promotion of prepayment and provision of complementary health insurance services for the vulnerable populations. Our journey to UHC has been a pragmatic one. We piloted the UHC concept in 4 counties and began to scale up on the lessons learned to the other counties as we implement output-based financing through our social health insurance scheme. In our journey towards UHC, we have learned a few lessons, and I wish to share some of these with you. Number 1, any country seeking to implement UHC will meet various hurdles and challenges, some of which include financial, legal, infrastructural, health worker capacities, availability of basic equipment and pharmaceuticals and consumables, which all impact delivery of basic essential services at the nearest health facility level. We have also recognized that implementation is time-consuming and labor-intensive. Number 2, there are opportunities we can seize and take advantage of. One of these is leveraging on ICT and cutting-edge digital systems. In our case, we are working to digitize the health system across all the levels of healthcare delivery through to the community level. Currently, a total of 20 high-volume hospitals have benefited from local area network connection and have been connected to the national fiber optic platform. The Ministry of Health, in collaboration with the WHO, is developing a single digital solution platform that will see an end-to-end electronic health record system. This solution will, among others, be able to collect, collate, analyze, and disseminate information that can be used for evidence-based decision-making at all levels of service delivery. Additionally, the digitization will also serve to promote health worker development and patient care using telemedicine and e-health platforms. Moving on to our implementation model of output-based financing, we believe it will allow for money reimbursed from the insurance scheme to be used to improve services at the facility level by increasing access to additional medicines, consumables, equipment, or recruitment of additional health workers based on the needs of the devolved facilities, taking into account that each have unique disease patterns, terrain, and resource gap requirements. In addressing sustainability, economic growth, and self-reliance, I wish to challenge us as African countries together with our partners and the private sector to begin domestic manufacturing of pharmaceuticals and other healthcare products. This will require deliberate effort, foster partnerships, address importation tariffs from raw materials, and implement strategies in favor of local markets. Clearly, the time has come for serious focus on local production of pharmaceutical commodities and equipment, including personal protective equipment, medicines, diagnostics, and vaccines. And this is clearly being seen during this COVID-19 pandemic and the rollout of COVID-19 vaccines, in which situation we are seeing the low and middle income countries lagging behind in terms of vaccinating their population compared to the developed world. One of the lessons Kenya has learned in our fight against COVID-19 was the local manufacturing of PPEs greatly reduced the unit cost of commodities by up to 10 times, not forgetting the capacity for us now to be able to manufacture for export purposes. Engaging in infrastructural development and mega projects and opportunities to increase access to in-country specialized care that will increase inward-bound medical tourism and scarce foreign exchange. In Kenya, we are building the capacity of the Kenyatta University Teaching, Referral and Research Hospital to be a center of excellence and hub for cancer treatment in the country and in the region. The hospital is poised to become the only public facility in East and Central Africa to offer the comprehensive continuum of care in cancer, with the establishment of an integrated molecular imaging center, diagnostic and treatment center, coupled with a hospitality facility. Yet another mega project is the East African Kidney Institute at the Kenyatta National Hospital campus, which will be a center of excellence in renal care, training, and research as part of the East African community's objective of development of relevant and highly skilled workforce in biomedical sciences. In summary, ladies and gentlemen, Africa is ready to measure the pulse of the health sector and address the gaps through partnerships and collaboration. Only then will we be able to take our health systems to the next level and increase access to the kind of healthcare that will facilitate economic growth in line with the envisioned trajectory of being the fastest growing economy in the world. I wish you all well throughout our deliberations in this summit. May it stir in all our countries an unquenchable drive to better our health sector to the advancement of Africa. Thank you all.
Thank you very much. Thank you, Dr. Patrick Amoth, on behalf of Senator Mutahi Kagwe. I'm really happy that your presentation also focused a lot on cooperation among nations across the continent. before we dive into the questions and answers session, there's an interesting short 5-minute presentation that will come from Cynthia and Mael on an upcoming award program for Africa Young Innovators in the health sector. So if Cynthia and Mael are here with us, I'd like to hand over to them now. Cynthia, I see you. Okay, I see both of you here. Kindly take it over from here, please.
Excellent. Thank you very much for the opportunity. So I'm Cynthia Genevieve, working for the IFPM, and I really thank you for inviting us today to be part of this Africa Health Industry Summit and being able to share with you the project that we're very excited about and which focus on creating and developing opportunities in the health sectors in Africa. So as I said, I represent the IFPMA, which is the International Federation of Pharmaceutical Manufacturers and Associations. So we represent the research-based pharmaceutical industry and the associations, and we are based in Geneva with official relation with the WHO, for example, and we represent the industry across the world, and I was happy to see also our colleagues from the RAP, the Ghanaian association here, and we have therefore 3 associations in Africa. And so the aim of IFPMA is to contribute to industry expertise to help the global health community find solutions to global health issues and to improve global health. So, but here today we are here to speak about the award that we are launching. So it's a Speak Up Africa and IFPMA award called the Africa Young Innovators for Health Award. And we're seeking to attract application for this award, and the award is very much about supporting the innovation from young innovators in Africa, from young health entrepreneurs that are looking to improve the situation of healthcare professionals. And so the award is about the winner will receive the $40,000 support to help him bring his innovation to life. Also a 3 months business mentorship program, and also expertise, support, advice on intellectual property protection as needed. And the aim is very much to support these innovations and to support the young in Africa, to support the innovation, new and bold idea that will support, equip, and protect healthcare workers, such as training program, equipment, protective equipment, or everything that can improve the quality of care. As we have seen very much in the COVID-19 pandemic, healthcare workers are the front line of fighting the pandemic and providing care to communities, to families, to people. And we thought that we will support this by supporting the young innovators in Africa. So I will stop here and let my colleague Mael speak a bit more about the award. Thank you.
Hi, everyone, and thank you, Cynthia, and thank you, everyone who is organizing this wonderful Africa Health Industry Summit. So my name is Mael Ba, and I'm the Strategic Communications Manager at Speak Up Africa. Speak Up Africa is a policy and advocacy action tank, and we are dedicated to catalyzing leadership, enabling policy change, and increasing awareness for sustainable development in Africa. We are based in Dakar, Senegal, but we work a lot in different countries, and in Ghana, for instance, where we are implementing the Zero Malaria Starts With Me campaign. So just going back to the award, I have copied and pasted the link inside the conversation part. And just as Cynthia was saying, to be eligible for the award, applicants must be between 18 and 35 years old and a national from an African country. And the focus of this award is the youth. And why? This is because young people are the continent's greatest asset, and we have the most youth population on the world and in the world, sorry. And we also know that there is a lot of entrepreneurship in Africa. So the applications are now open, and they are based on the several criteria. And it's the innovative character of the ID, the ability to scale their ID, it's the measurement, and also the sustainable impact on health. So the applications are on the website. You can check it out, and they will be closing on March 31st. So we really encourage you and everyone to share the process. And if you have any questions, please let us know. You have a part for contact on the website. And also one last thing, this award is supported by AMREF Health Africa, Broadreach International, the EcoBank Academy, IntraHealth International, Microsoft for Africa, and the RBM Partnership to End Malaria, and also Social Change Factory, Télésud, which is a French TV channel, SciDev, and Africa.com. Thank you everyone for listening, and yeah, looking forward to receiving more applications.
Thank you very much. So, ladies and gentlemen, thank you very much for sticking with us through it all. We've come to the end of the presentations, and it's time to ask questions. Esther, I don't know if you can open the floor so that people can ask questions directly, because I am going to read the questions that we have, and it's going to be over a period of, say, 10 minutes. If I run out of questions, then and there's the opportunity, I'll be glad to have some of you answer some of the questions directly. So there's a question from someone who said, let me just get to that. Mrs. Teresa Yamson, are you here with us?
Yes, I'm here with you.
Okay. So somebody asked about what's your take on daily multivitamin usage, long-term usage. I see OA, COVID-19, and then said multivitamins should be indicated for, but it's hard to determine relevance and toxicity. What do you have to say about that?
Well, I think I tried to also answer in case the person who had put it needed to go off in the chat room. But clearly, obviously, if you've been by, say, a medical practitioner, you've been actually given a certain prescription for long-term use of vitamin and supplements, this is something that can be then part of your daily medical routine. However, in light of the fact that where we live, we have access to a lot of fruits and vegetables all year round, it's actually quite important also to ensure that your diet includes as much of this in order to have the right vitamins, minerals, supplements, and then fiber that will help to complement your entire regime for yourself. And in this respect, personally, I would say if you're young, if you're healthy, this is the best way to go. Naturally, with our busy lifestyles, with the fact that, yes, we may not be able to always do this, this is where the supplementation and perhaps even sometimes long-term supplementation with extra vitamins, especially those that are easily flushed out of your system. Vitamin C is one that we need almost every day and therefore cannot store. So in that sense, it's actually advisable, if you can, to have a good source, a reputable source, and to know the right dosage that is required. It's important never to exceed, and this is what a lot of times people, perhaps over long term, use of certain minerals or vitamins may not realize that build up in the body can also be perhaps an adverse effect. Small doses recommended for use, and you'd see that any medication you buy will give you the right dosage and therefore frequency also in order to help you to be able to stay within that limit or level. So I hope that answers the question. Thank you.
Yes, it does.
Yes,
thank you.
yes. Thank you. I understand that we have Dr. Baita Dinah from Uracare who would like to share a point. So Dr. Baita, we can give you a few minutes.
Thank you. Good afternoon. I was asking myself, was there a way to get like a 5 minutes break at some point? But it's okay. I've been sitting down here listening from the beginning. Okay, so I'm Dr. Baita, the Business Development Manager for Urake Advanced Diagnostics and Heart Center. I'm also a general practitioner. I wanted to share a few pointers from the private sector with regards to the need for acute stroke services in Africa. I've listened to all the panelists, and indeed, we're becoming more like other parts of the world where diseases found in the developed world is now present in Africa, especially the non-communicable diseases, all ending up with stroke. What I want to talk about is stroke, and the reason why all stakeholders, or let's say the reason why we need to improve upon public-private sector partnerships to bridge this equity gaps in providing care for patients who've had a stroke. So it's going to be like just 5 minutes. So the current state of acute stroke services basically is indeed an important emerging public health sector concern, where we have increased stroke-related mortality and morbidity, similar to what you get in other parts of the world. We have, let's say, an incidence rate of about 316 to 100,000, and a prevalence of 14.6 cases per 1,000 people, with a 3-year mortality rate of 84%. In Ghana, stroke is one of the 5 causes of death, and considered the main cause of adult disability. Risk factors basically are with hypertension, because we have increasing rates of hypertension, cardiovascular disease. This is worrying because it causes major healthcare costs, not only to the government sector, but to families, and then to the infrastructure that's already existing to provide human resources to look after patients. I would say death and neurological deterioration after a CVA or a stroke can be reduced once the patient has access to acute stroke services, where what is actually done is to recanalize the arteries that provide the oxygen and blood or nutrients, that part of the brain that's suffering either from a clot or a bleed. The last year we celebrated World Stroke Day. It's a global health awareness day, celebrated on 29th of October every year. We noticed that most of our major cities have access to advanced diagnostics, like CT scan machines and MRI machines, but we don't have that in other regions. So a few doctors from the Kolebu Teaching Hospital, which is one of the first tertiary health facilities built in Ghana in the British colonial time, they are the only facilities that offer advanced diagnostics. And we've been speaking with some people from government. How can we set up more advanced diagnostic centers across the country? Now we have more than 10 regions. So we're still talking about it. What's important is we believe, or every doctor knows, that good outcomes always occur when you can close the gap between the time you have a stroke and the time you access the service. They call it a door to needle window, which is 1 hour, between an hour and 4 hours, or it's called the time is brain, or time is imaging is brain paradigm shift. The purpose for all stakeholders, let's say, to help the healthcare sector to develop more acute stroke services, because we think it will be important, thus help manage increasing death rate and disabilities. A lot of the working class, especially in their 40s and 50s, have hypertension because our stress factors have gone up, and you can even find people in high school with CVA, you'll be surprised, already with hypertension from the age of 14 years old, end up in the hospitals. We believe with partnership, and I love this seminar that we organized, that was organized today, to create more opportunities for B2B discussions or B2D discussions about how can we bridge that gap between the patient having a CV and access to healthcare. How do we raise funds? How do we educate both the public and medics? How do we reach out to international communities to help us or help our people access care as and when is indicated? So I believe from today, from this discussions held, if we can have other forums to discuss how we can help with this equity gap for West Africa and across Africa, and to help improve the quality of life for most of our patients with stroke. Thank you. I think I'm done with that now.
Thank you very much, Dr. Bite.
You're most welcome.
I think that you've made a very important contribution to the forum today, and it was important that we had that on presentation. I don't know if Madam Lucia is here with us. Are you here with us?
Yes, I am.
Okay, so I wanted to be sure that you were with us. Someone asked, I think Christian Kofifia asked, if the production capacity regarding medicines locally is in Ghana, for specifically, is around 30%. What is the Pharmaceutical Association doing to attract more investment to help increase the percentage of production? Are there any specific things that your association is doing to attract investment into the sector?
So specifically, we are doing a few things. Like I mentioned, the first thing is that it's important that you create that awareness and then advocate that investment and funds should actually be put into the industry or the sector. Some of these funds will come from government and some from private sector. We've lobbied over the years and been able to get some affordable finance from government, and it came through the Exim Bank. So it was very affordable. We've had some of our members benefit from it. So some of our members are going, about 9 of the companies will be able to increase their capacity significantly. They would still be doing the capsule syrups. One of them is the company that I mentioned, Transatlantic Pharmanova, who is venturing into vaccine manufacturing, and he's not going to manufacture end to end. What he's doing is that he will bring some of the vaccines into the country and then fill, which will make it more affordable for the country. So awareness, advocacy, being able to lobby and get finance from government at affordable prices or affordable rates. And then there's also engagement through WAPMA, to be able to get investors to come in. Apart from resources as in finance, there are other things that the industry needs that we are also working on, some of which is technology transfer, the human resource, the quality and skills of the human resource. We are still working with a few of the stakeholders to be able to train enough personnel to fill in the gaps. So there's so much to be done. There's so much that we are doing. Policies in terms of the market, so there's a governance. So we've actually been able to segment it into various, let's say, sections or points. So we have the governance, we have the affordable finance, we have the technology transfer, we have the markets, we have incentives, and a few others. So we are still working, even though I'll say it's slow. We are working cautiously and steadily to be able to increase it from 30% to 60% in the next 5 years. Thank you. Over.
Thank you. Dr. Francis Smart, are you with us? Hello, Dr. Smart from Sierra Leone.
Yes, I have returned.
Okay, fantastic.
I need to finish this.
Yes, so there's one question. It says that the free healthcare service in Sierra Leone, does it cover non-communicable diseases? And also there's a question from Tony Danso Apia, which has to do with policy across Africa. And it says that a lot of the healthcare policy across Africa simply does not appear to work. This is his opinion. I am not in any position to corroborate it because I'm not on the field, but I'm sure you will have something to say about that, because he said that I think he's trying to say that there's a need to shift emphasis from traditional research to implementation research, and he thinks that most countries are getting it wrong because the evidence used in supporting most policy is not generated from well-synthesized studies, and to which extent he wants to know to what extent this can be addressed, and how can best evidence from I think from the research play a role in future summits. Okay, so that part is for us. But so these are two things that I think you would need to address. These are for you. What do you have to say, sir?
Okay, thank you very much. I will start with the easier one. That is the free healthcare initiative in Sierra Leone. Yes, it doesn't cover non-communicable diseases. And I have to point it out straight away that non-communicable diseases, is on the rise also in Sierra Leone. There's this double burden of diseases. But it covers primarily pregnant women, lactating mothers. It also covers children under 5. And initially, these were the three main categories. Later, it has been extended to cover children, and provision is being made for that currently. There's consideration also. It's not even consideration. There's a policy to that effect, but we'll not be able to do it because the preparedness wasn't there. You recall we had victims of the EVD outbreak, and a number of people still living. We needed to cover them on free healthcare. So we had expansion, and we are currently working on the essential health package for UAC so that it will cover other vulnerable groups. But to be precise, non-communicable, not covered, and hypertension and obesity, hypertension and diabetes are on the rise in this country. Regarding policies, yes, I mentioned this, and this is the truth. For Sierra Leone, particularly in fragile countries where also the practice of democracy is on the edge, you have issues with implementing policies. For Sierra Leone, I try to mention since 2009, we didn't have a national health policy. So, and some people will know that when we had EVD, it was so difficult for us to take action because we had the 1960 ordinance, which did not talk about restrictions. So you see how for the challenges of COVID, many countries are grappling with policy issues. So I can agree with the concerns of that speaker that indeed policy issues relating to health is important, particularly when you have to talk also about the implications for ethics. I mean, where will my rights stop when you want to vaccinate me for certain diseases? But also importantly relating to financing. And yes, we know there are some sub-regional protocols on this, but they are not complied with. And so you can see, for example, the Abuja declaration for our own side here. Some people are below 10, 11, and we are tending towards 15. So these are indications that we have serious problems with health policy, which relates to both the governance and financing. And lastly, in terms of evidence, this is also true. There are evidence issues. Most of the evidence is for particularly smaller countries like ours, and considering the background I spoke about, I'm sure it's the same for Liberia, for Guinea. The evidences are usually from other countries, other bigger countries, countries that are different from us. You see, so I mean, when you work within WHO, you will see that all the evidences they bring from elsewhere, but particularly we who have suffered from war and fragility, you will see that we have plethora of NGOs, and when NGOs come, they come with their conditionalities. They almost I want to say with due respect to the NGOs, because they help us a lot, but they want to dictate the evidences, and these evidences are at variance sometimes with local context. So indeed, evidences and implementations are rare issues. We think this kind of coordination will also abide. I mean, when it comes to medicines and pharmaceuticals, you can get standards, regional standards that you can agree on, instead of just bringing in drugs from other countries. We have drugs here that are not even written in English. You can imagine. On that note, let me stop there. If there's any more, we can always communicate and I'll answer the questions. But these three issues are, I think, critical for us to get health to our population in the way it is desired from us. Thank you so much.
Thank you very much, Dr. Smart. We're about to bring the whole event to a close, but I would like to ask you a question, Dr. Smart, which is a question coming from me. For two questions, actually. One, is there a concerted effort by policymakers, the government in Sierra Leone, to inculcate traditional treatment protocols or medicines into the healthcare delivery in Sierra Leone? And secondly, I would be grateful if you could give us a brief overview of entry procedures and entry requirements for healthcare for industry actors. Could be pharmaceutical companies or medical device companies or just equipment suppliers. What's basically the entry requirement for coming into Sierra Leone?
Okay, thank you very much. I'll be brief. Traditional medicine, as you know, is being part of the Maputo Protocol, and WAHO for the sub-region here, West Africa, have been promoting it. Unfortunately, on the ground, the traditional practitioners tend to undo what Orthodox will do. And so at some point, we started working and there was a policy, and they were under the primary health care, but the leadership in the traditional tend to meddle with our national politics. So there are outstanding issues, but I know I attended one meeting and we are trying to review that policy. But we think it is best they are with us so that we can know what they are doing and we can mitigate the risk and things like that than when they are just out there and we know they are a significant part, particularly when you look at the level of illiteracy in our country. For the entry requirements for health-related business enterprises, I think it's the same for other businesses. There's a lot of improvements already. When it comes to NGOs, they register with the Ministry of Economic Development, which works closely with the Ministry of Finance. But when it comes to business enterprises like pharmaceuticals, they work, the lead point is to go through the Sierra Leone Pharmacy Board if they have to register some medicines and things like that. But also the clear pathway for business is when they go to the Ministry of Industries. We have a Ministry of Trade, and then there are requirements, there are clear requirements. We know generally for business, there were issues of long delays and things like that, but we know this is now clear. To make it simple, anybody who wants to do business in the ministry, in the health sector, should approach the Ministry of Health and Sanitation, and we will navigate him through without any delay and without any further hindrance. But the easiest entrance point will be through the Ministry of Health and Sanitation. Thank you.
Thank you. Yeah, but I was saying that thank you very much for staying with us through it. It's been a very insightful first edition of the Africa Health Industry Summit. We'll be back again in 2022 with the second edition of it, and we hope to continue to use this platform to throw light on the health industry to make it the better to deliver its objectives to the people of the continent. I'd like to say a special thank you to GIHOC. Thank you for being such worthy partners. And I'd like to wish the creators of the Africa Health Innovation Award all the best of luck in that event. We'll support you any way we can, because this is very dear to our hearts that innovation on the continent of Africa is promoted, especially in the health sector. The World Trade Center Accra will keep working very hard with all our partners to promote African industries and opportunities for African businesses and entrepreneurs. In a few weeks, we are going to be back again with the Africa Feeding the World Summit, where we'll focus on agriculture,